So we are about bad moods, bad periods, and badass results. So we do something called quantum nutrition testing, and we kind of want to get to the root cause of why people have their symptoms. So let's get started. Um, so bad moods, bad periods. We know that hormones can regulate pretty much everything: temperature, hot flashes, mood swings, anxiety, depression, anger, frustration, cortisol levels can regulate even how you digest things like food, can regulate your sleep cycle and your PMS. So, how many women have really bad periods? Your periods kind of suck. So, you got bloating, cramping, backaches. Let's not talk about the breast being tender, the weight gain, possibly some hot flashes, and the food cravings. Oh my gosh, the sugar cravings and the salt cravings. Who doesn't have that? And everybody thinks like you're a Jekyll and Mr. Hyde, right? And you're a completely different person around your cycle. And everybody wants to stay away from you. Okay. That doesn't sound like fun. And some women get periods so bad that they are cramping and they have to pop a Midol, or they have to pop a Motrin or Tylenol or whatever. And some people even need to lay down, put a heating pad on, and it's miserable, especially for the first couple days that they get their cycle. And not only that, but leading up to the cycle. And I know this, I've experienced this myself. And who knew that? Guess what? You're not supposed to have these symptoms. You're not supposed to have mood swings. You're not supposed to have heavy periods. You're not supposed to have blood clots the size of golf balls coming out when you have your period. You're not supposed to be running through super, the super tampons, with a pad every couple hours. Your breasts aren't supposed to be swollen and tender and sore. Who knew that? Who knew that you weren't supposed to have that? Well, guess what? Guess what PMS stands for? Premenstrual syndrome. Let me ask you, is a syndrome normal? And why is it that we normalize common symptoms? Just because it's common does not make it normal. So, again, PMS is a syndrome. Syndromes are not normal. So, guess what? You're not supposed to have symptoms. So, if you are suffering from heavy periods, what do they do for that? So they put you on birth control pills. Let me tell you a little bit about my own personal experience, and I'm sure, and it would be wonderful if somebody, if you've had any experience with birth control pills, I would love to hear your your experience. So my experience wasn't so great. I was skipping my periods, and I was late teens, 17, 18, skipping my periods. And a week before my period, I was getting really depressed and really anxious. So, because I was skipping my periods and because I was very anxious and very depressed, they decided to put me on a birth control. Now, this was almost 30 years ago, not quite 30 years ago. I'm not that old, but getting there. Um, so almost 30 years ago, and they decided to put me on birth control pills, thinking that that's going to regulate my hormones. Yeah, that was a whole extra story. That in and of itself was a nightmare. So they put me on something called orthotricycline, which was a birth control, common one that was used way back when. And it basically has 3 different levels of hormones in there, hence why it's orthotricycline, because 3 different levels of hormones throughout the month, trying to balance out women's hormones. And remember, these are synthetic on top of that. So, can your body process synthetic things? No, it's a chemical. Guess what? Your body is a natural thing. It recognizes natural substances, not synthetic and not chemicals. All right. Hmm. So they put me on orthotricycline, and I started not just having mood swings right before my cycle. Oh no, we had mood swings all throughout the whole entire darn month. And they call that, so I would go up and down, where I'd be happy, I'd be depressed. I'd be happy, I'd be depressed. And sometimes these mood swings would happen even in one day. And it was really bad. And it got to the point where I became suicidal and I had to be hospitalized. And because I was rapid cycling and nobody thought that it could have been from the birth control pills, I got diagnosed with bipolar. And then I was put on more psych meds. And then I felt like a freaking zombie from the psych meds. And I gained a whole bunch of weight. And I was still depressed and anxious 1 week before my period. So, needless to say, they missed something. And how many times do you guys feel like you talk to the doctor and you might feel a little bit better, but you're still feeling like something is being missed? You do not feel your normal self. You have mood swings. You're tired. You are skipping your periods. Maybe you're having really heavy cycles. Maybe you're having blood clots. Maybe you have endometriosis. Maybe you have fibroids. And maybe they want to remove your uterus. So I don't know about you, but cutting open the body and removing parts that are supposed to be inside of our body is not a natural thing. Now, I'm not saying that sometimes surgery isn't absolutely necessary, but in a lot of cases, it is one of the first things that's suggested. If the symptoms are really bad. So, or or the doctors will try some medications. And let me ask you this: do medications fix the underlying cause? No. Eastern medicine always begs the question, okay, well, yes, if you have fibroids or if you have mood swings and it's a hormonal imbalance, the question still remains is why do you have the hormonal imbalance? What is the underlying cause? Okay. And there's a couple different reasons on why you have your bad moods, why you have horrible periods, why you have hormonal imbalances in the first place. And these can actually be from parasites. Parasites are known to cause hormonal imbalances. So does mold. Mold can cause tons of hormone imbalances. Actually causes a lot of brain fatigue. Mold can cause joint pain and inflammation as well. Um, so what is the root cause? What organs are not functioning optimally? Just because you have normal labs does not mean your organs are functioning as well as they could be or should be. So if anybody is joining, please give a shout out. Would love to hear from you. So I think we have somebody joining us from Instagram. So anyway, so yeah, so what is the underlying cause? All right. I don't want to just, okay, yeah, you have a hormonal imbalance. Let's give you a medication. Let's find out why do you have that hormonal imbalance. And again, it could be, mold, it could be parasites, and just because your labs are normal does not mean it's normal for you. How many times have you guys, like I said, gone to the doctor and the doctor says that your labs are fine? I don't know why you have your symptoms here, have a pill. Okay. So Thyroid levels can be off even though they're in the normal range. They can be off and they might not be normal for you. Okay. Remember, when we do blood work, we are comparing your blood work to everybody else's. Just because it's normal for one person does not mean it's normal for somebody else. TSH levels, the range is zero point 0.4, and depending on what lab you use, I've seen where they upped it to 5.1. It used to be 4.5, but even let's just even stick with 4.5 for right now. So the average range, so the range for TSH levels is 0.4 to 4.5. If you really think about it, that's a huge range. And as long as you fit somewhere in the middle, as long as you're somewhere in the middle, I deem you normal. But maybe your body is happier at a 2.3. Maybe your sisters or your brothers is happier at 3.0. So can you have some small symptoms starting to form with normal labs? Of course you can, because your body's not happy where it's at. Okay. Just because it's in the normal, again, it might not be normal for you. And that's what I like about quantum nutrition testing, is because we're basically finding out, hey, what's going on with your body, whether you have normal labs or not, and getting to the root cause of why you have symptoms and not just masking them. So and not only that, but TSH levels, that's measuring the pituitary gland, not even the thyroid. It stands for thyroid stimulating hormone. So if it stimulates the thyroid, it's got to be coming from a different gland. And it's not even coming from the thyroid gland. Okay. So, and that's usually all that doctors turn around and base thyroid levels off of, is just the TSH, which again doesn't even measure the thyroid levels, or thyroid gland, it measures the pituitary gland. You have to do a whole other set of blood work to even get a general idea of what the thyroid is doing. And even then, that's still sometimes not completely accurate. So let's find out, well, why do you have your mood swings? Why do you have your bad periods? Why do you have symptoms? Why do you have an hormonal imbalance? What organs are not functioning optimally, and why? So what's kind of cool is that a lot of women, when we balance out, when we get rid of the underlying cause and we balance out the hormones naturally, their cycles start returning. They start growing hair again. So ladies, if you have thinning hair and your labs are normal, guess what? It's probably not normal for you. There's a reason why your hair is thinning. And it's usually a hormone imbalance. And it's usually caused by parasites and mold and some other things too. So let's get to the root cause. You know, where your hair will start growing back, your nails become stronger. You actually can have normal periods. And what do I mean by that? No symptoms, no PMS symptoms, no clots, no cramping, no mood swings, no breast tenderness. Oh my goodness. Wouldn't that be amazing? Are you guys ready for that? Do you guys really want, like, painless periods instead of painful periods? Painless periods. Wouldn't that be amazing? Where you're not, you don't become like the witch right before, your cycle, and everybody's not clearing out their schedule to stay away from you right before your cycle. Like, okay, let's keep her on a calendar. Let's kind of check that calendar. Okay, we all know that mom turns into, blah 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 right before, her cycle. Wouldn't it be nice not to have to have your family walk around on eggshells around you? Wouldn't it be nice to feel yourself around your cycle? And a lot of people do. You start balancing out the hormones naturally, and you don't have those symptoms. And on average, most of our patients, which is really kind of cool, no matter what you're suffering from, whether it's insomnia, mood swings, most patients have an average of a 25 to 50% improvement in just 3 months. That's pretty significant. If you told me that I could start feeling better within 3 months, a 25 to 50% improvement, I'd be like, "Sign me up." You know? A lot of you women have been suffering for this, and I hear this all the time. "I just push through." I don't have time to deal with this. So, yeah, I feel like crap, but I just push through. Are you one of those women that just pushes through? Or are you ready to say, enough is enough and take back your health? So it's time, ladies, that we do so much for other people. It's time that we give back to ourselves. It's time that we take charge of our health. Let's get to the root cause. Let's take care of it. Don't suffer. You don't have to. Okay. Stop with the migraines. That could be a hormonal imbalance. Let's get rid of all that stuff. Let's have a normal cycle. Let's not have to worry about, is my period going to put me out of work for a couple days, or am I going to miss kids' activities for a couple days because my cycle is so bad? Let's stop worrying about that. If you would like more information, we have virtual and in-person appointments. If you would like more information, if you would like to take back your health, if you're tired of having bad moods and bad periods and you're tired of PMS issues, and if your doctor says we need to get rid of your ovaries or uterus, whether you seek my help or somebody else's, maybe go get a second opinion and a more holistic opinion just to see what can else be done, more naturally. So that way you don't have to have surgery. All right. So if you'd like more information on what we do, please give us a call 708-554-6730. Otherwise, you can always leave a comment or you can PM us and private message us, and we will get back to you very shortly. All right. Have a good night, guys.